Okay.
Hi, everyone. I'm Michelle Anderson. I'm the president of Rockland College, and I am so happy to be with you all now. On this live video chat here at Instagram. We're starting a little early because Carrie and I are playing with the technology. I will say this for you, okay? Time that we're doing, and we're going to do it better next time. And we've already learned so much from the people who are listening in. So thank you all for listening in and teaching Carrie and me how to do this technology. It's my first time doing Instagram Live. So here's what we're going to do. Carrie and I are going to talk a little bit for about 15 minutes, 10, 15 minutes. And then we're going to turn to your questions, okay? And we want to hear from you. We want to hear your questions, so we'll try to answer them as they come in. So the first thing I want to do is just give you a little overview of what's happening in New York City. Today we are up to 40,000 cases, more than 40,000 cases just in New York City. 27% of that. So we have a particularly high number. We've got more than 10,000 positive cases just in Brooklyn. And Governor Cuomo indicated today that we haven't reached the apex, right? So let me do it in the door. Still headed on an upswing. And that's going to be a challenge for us all. We need to sit tight. We need to stay home. I'm home. Carrie's home. And I hope that you're home if you're listening to us. I want to introduce you to Carrie. Carrie Sadovnik is leading essentially the ground team on our emergency response to the COVID-19 pandemic here on, y'all like my RBG poster right there? Yep. So Carrie Sadovnik is leading our work here on response to COVID. Before joining the college, she had more than 20 years of experience in the field of health and safety. At the New York City Health Department, for instance, she oversaw a team of 50 safety officers for emergencies ranging from the 2009 H1N1 influenza pandemic to the 2015 Legionnaire's disease outbreak. During the Ebola scare, she was tasked with ensuring that New York City health officials were themselves safe while they investigated the potential spread of the disease. She brings extraordinary expertise to Rockland College, and we're lucky to have her here with us. Carrie, welcome to our first Instagram live feed. I'm really glad you're here. We got a little heart for you. Yay. They just started.
Yay.
I want to ask you, we got a couple more. I want to ask you, Carrie, how your expertise, how your experience with H1N1, with Ebola, with Legionnaire's disease helped prepare you for the work you're doing now at Rockland College, and how it changes your perspective of the work you're doing.
Sure. Thank you so much, Michelle, for inviting me to speak with you live. Also my first time doing this, so thank you everybody for being patient, and I promise I'll put some bunny ears on later. I've been doing this for 20 years, over 20 years, and I've worked in private industry, nonprofits in New York City, and most recently with government before coming to Rockland College. I love the college. I've been with you guys for 5 years, and I can tell you the students are just make my everyday. It is such a pleasure, and I cannot wait to see you guys on campus. My interns that I work with just make my day. You're so full of ideas, good ideas, and you're really the life of the and heart of the campus. But I also want to say a shout out to Michelle and the team that you brought together. One thing I learned, I came to New York City about 20 years ago, just over a year before 9/11. And 9/11 was very devastating for all of us who were living in the city. And from that and then that aftermath, we quickly realized that public health and being prepared for public health emergencies is something that needed to have additional attention brought to it.
Yeah.
And in the years following 9/11, I had the opportunity to work with and plan and do exercise, as in tabletop exercises, with other health officials and city agency leaders from New York City, as well as other agencies. And I would say that prepared me in learning that having the plans in place, understanding what you're going to put in place right at the beginning when a disaster such as Superstorm Sandy hits, or a terrorist event, or a public health emergency like we're seeing right now. If you can get those relationships in place, which Michelle has done a beautiful job bringing this response team together, and all the right people are at the table, and we have guidance from CUNY, and all of that's bringing us to this place of being able to respond. I'm hoping that we are getting very close to the phase of recovery where we can start working on bringing us back to campus, because we're all itching to get out of our houses and get back to our daily routine. What is so important for all of you students is having that routine, and that's going to help us do better when we get to recovery. So focusing on, I know we all want to just play board games all day, or GTA online, but sticking with your classes and the remote learning that you're doing, that you started to do and that we're going to continue to do later this week, is part of what's going to buoy your spirit and get you through this period. It's also prepared me to urgency in that it's a chain of infection. And what we're trying to do as public health officials and leaders in the city is to chop that chain of infection, break it down. And so initially we were focused on identifying individuals, putting that fence around the individual and the contacts so that the infection stopped there. Unfortunately, with this disease, as is the case with the pandemic, it is unpredictable.
Yeah.
And no matter the amount of preparedness that you can put in place and the amount of planning, the thing that is an unknown is, what is the disease? Do we have the medicine to address it? In this case, we unfortunately don't. And who's it going to affect? So some of that was being learned in those early weeks. Oh, stop speaking. Okay, I'll stop speaking.
Well, it's okay.
And I'm going to pass it back to Michelle.
For everyone who's just joined us, Carrie and I, who is the Environmental Health and Safety Director at Rockland College, Carrie and I are going to talk for about 10 more minutes, and then we're going to answer your questions, okay? If there are questions that are appropriate for me, I'll answer them. If there are questions that are appropriate for Carrie, she'll answer them. And if neither of us can answer them, then we will get back to you with people who can, okay? So I just wanted to help us, that is Carrie and I, share with you some of the things that we've done on the campus. We have an emergency response team. We meet every morning for an hour or more. And we review all of the key areas across the campus, both academic and operational, trying to ensure campus safety for all of those members of the essential staff who have to remain on campus. We're trying to stagger their workload and decrease their workload so that they don't have to be on campus in any full-time sense. I'll give you just a couple examples. Public safety officers have a staggered workflow. They're not on campus full-time. Custodial staff also have staggered obligations to come on campus. They're not on campus in a full-time schedule. We have closed down as much, had the custodians go in, clean a space and seal it so that we don't have to go back and continually clean it. We are trying to very narrowly identify those who have to be on campus in order to protect their health and safety. I know you want us to focus on your studies at home, and we're going to get to that shortly. But I just want to first assure you of sort of what's happening on the campus itself in terms of preserving the safety of the space, trying to limit the places where people have to be on campus. We were one of the campuses across CUNY who stepped up very aggressively to get people to stay home, to leave campus, to gather what they needed and to go home. Because the public health imperative here is stay home wherever and whenever you can. So we've gone through the process of the faculty has really stepped up, extraordinary, developed learning opportunities, and now delivering those to students. Students have really stepped up, and I know it's been incredibly challenging for many students, and we're trying to deliver all of the services that we would normally deliver in person: personal counseling, health clinic, lots of other services. We're trying to deliver as many of those as we can online or in a remote way. For those services where we can't, like the food pantry and like the delivery of actual computer devices for those who don't have them at home, we are doing those in person in a staggered way. Everything we do on campus, folks, Carrie helps organize, because she puts up shields, she provides PPE, the protective device, and just wanted to share that with you in terms of the challenges we're facing. And it looks like people mostly have questions about graduation and studies and things like that. So before we turn to those questions, maybe we should skip to that a little earlier, Carrie, but I wanted to give you an opportunity.
Sure.
Do you have other things that you wanted to share before we kind of turn to the questions?
Well, I think it would be helpful if we just talk about I know we're going to get some of this information out later today about the device distribution.
Yep.
But someone had a question about online learning, and not everyone signed up, or not everyone has that ability. And that's one of the things that was really important about the recalibration period, is making sure that we address equity issues and give everyone who doesn't have perhaps a laptop or a Chromebook at home, who's just working off their phone, which would be incredibly difficult. I couldn't imagine doing that for remote learning, to make sure that they have a device that will help facilitate that work at home.
Yeah.
So that's we've set that up so that students can come safely on campus and get a device that's going to start tomorrow. And I know that there's more information that's being either posted or going to be in your daily message, Michelle. Yeah,
you can get to it by the regular link on the homepage to the COVID website. So students can make appointments for those devices now. Gosh, the questions are extraordinary. They just keep coming in. So why don't we slow down, take a look at the Q&A list. Let's see. Is the fall semester going to be remote learning based? That's one question. We don't know right now. We need to plan for every possibility, though. The reality is that it depends on how spiked or flat the curve is. You know that from a public health perspective, we want it as flat as possible. That means a more extended period of time for us to remain indoors and away from each remote learning format. We don't know, though, whether or not it will go through it's certainly going to go through the spring semester. We assume that it will go through the summer semester, and it may go to the fall. We are very much trying to prepare for every eventuality so that we are ready for it. Next question is, what will happen to our graduation ceremony? Such an important question. I wish I knew. The graduation ceremonies across CUNY are being reevaluated and coordinated. They are going to deliver to us some kind of guidance on what we can do. They're looking at a couple of different options. None of them are ideal. They're looking at delaying the graduation, doing an online version of graduation, pulling a lot of campuses to mushing the spring graduation with another graduation in the fall. So it's a very good question. I wish I could tell you more. I will tell you as soon as I know a thing. Someone asks, can we graduate on Zoom? God bless you. Maybe we can. Let's try to figure something out. We don't have an answer to that right now. Next question is, will the students be reimbursed for paying activity fees, club fees, other fees, the services, but are not able to use? Just last night, the CUNY Board of Trustees made a decision that 25% of the student activities fees were going to be refunded back to the students this year for the spring semester. We don't know how that's going to happen. We haven't been given the details, but that is one of the fees that the board has taken up. I will tell you as soon as I know more about how that's going to happen. Let's see.
Maybe this is a kind of a pressing question,
Sure,
Michelle.
Sure.
And I'm going to punt it to you. Sorry for the sports analogies. It's about students who can only pick up a device after Wednesday, but the recalibration period ends on Wednesday.
Oh, that's a really, in fact, we are going to continue to distribute devices until we're done, until we run out, and we've got a lot of them. So we're going to allow people to make appointments on Thursday, Friday, possibly into the weekend. It depends on how much demand there is. If you need a device, you need to get online and make an appointment for it. We are giving you, loaning to you what you need to complete the academic work of this semester, but you have to work with us and set up an appointment so that we can stagger them and make sure we deliver them in a way that is safe for you. Let me see. Are we getting some type of reimbursement for having to switch to online classes? Under CUNY rules, we don't reimburse when the class remains ongoing. So the answer to that is no. Next question. Unless, of course, the Board of Trustees changes its mind on that issue. Will summer classes be online? Look, it is likely that we don't know. That's a short answer because we don't know what the curve of the pandemic, though, to be able to deliver summer classes. Summer classes are more inconvenient for some and more convenient for some. They are imperfect, to be sure, especially when faculty are not, have not developed the pedagogy of online teaching, and they are moving from an in-person class rapidly in the way that they had to this semester to a remote learning format. We're learning, though, the faculty is learning, the students are learning, and we are trying to move as rapidly as possible. Can we choose the option between a letter grade and a pass-fail grade for each class? I believe the answer is yes. I think the Board of Trustees just last night passed a resolution to that effect. I'm the one who's sending you these daily updates, and I'm going to look at that and ensure that I understand what the policy is and explain it specifically in my message. Either I probably won't be able to do it today, but I will this week, okay? So I think the answer is yes, and I will let you know about that specifically.
I'm going to just jump.
I said the word pedagogy. Someone was like, what does pedagogy mean? I apologize. It's language of an academic. It just means how you teach, how you do the instruction. Carrie, you want to take one of these?
Oh, well, I was going to comment on people are talking about being stressed and not being able to focus at home.
Yeah. And
I think someone also asked about online counseling.
Yep.
And so just acknowledging that this is the most stress many of us hopefully will ever face in our life. This is incredibly stressful, and it's understandable if you're having a hard time focusing on your classes. Establishing a routine, having a dedicated, if you listen to music to help you focus. I think we're going to take some of these questions and we'll try to address them with the right people after the fact. So keep asking them. We'll pull them up and make sure we get back to them when we have more time.
So one thing I want to say is about online counseling. Yes, we have online counseling. Our personal counseling services at Rockland College, which are free to students, are available via video chat now. What you want to do is you want to go to the homepage of Rockland College, jump on the page. It's right at the top. It says COVID updates. Go to the page on COVID updates and then go to student services on the right-hand column. And it gives you a link to email and phone call for telemedicine and for psychological counseling. There's no reason you shouldn't reach out. It is a good thing for people to take care of their mental health in times of great stress. We are in times of great stress, and we have mental health counselors waiting to try to support you. So please reach out and please do that. Let's see, the resources, Anita is awake, is telling you on the screen where you can get the resources. So thank you, Anita. I will make sure, again, in today's message, which I hope to be able to write up and send out this evening, I will make sure that I mention again how to get access to free health care, mental health care. Let's see, we did commencement.
I also want to just, someone mentioned losing, I don't know, family members or friends, and that's a tragic reality that many of us are going to face. And I want to first say I'm sorry for your loss, and I think that your professors are going to be very forgiving and understand the situation. So maybe, Michelle, if you could just talk to how do students who are dealing with loss, who do they tell? And
yeah. So one thing, you can go straight to your professor and talk to your professor. You can email your professor. Sometimes for some people that doesn't work and they don't want to do that. You can reach out to Student Affairs. It's just Student Affairs, no break. It's Student Affairs.
Oh, it's on the screen.
Okay.
Anita, thank you.
Great. Rockland.cuny.edu, and you can ask them to talk to your professors so that you don't have to reiterate the same story to the multiple professors that you have. You can reach out and get free personal counseling, and you can take an incomplete if you have to. You can delay the assignments, and you can take an incomplete and complete the coursework over the summer. Here's the thing. I think there are lots of, the death of a loved one is huge, extremely painful, devastating to someone's life. We're all facing a lot of challenges. And as I said in my message yesterday, this pandemic is likely to become more personal for many of us. We just had to let people know to announce that the first member of our community has passed away as a result of COVID-19. Mark Bloom, a professor for 15 years in the Department of Theater, an extraordinary professor, an extraordinary human being. And unfortunately, what we know about this is that we're not at the, as the governor said, we're not at the apex of this crisis. We're likely to have more challenging times ahead. As these things become personal and hit us more personally, please take care of your loved ones. Please take care of the people in your life who are going through the most grief. Please reach out if you are going through pain and grief yourself. The professors, the administration, Carrie and I and others, and all of the professors want to be accommodating this semester. There are bereavement professors. That's exactly right. We have expertise on bereavement and death. And those experts, by the way, helped us develop our policies at Rockland College on how to deal with what we do when a student has a death in the family, or a faculty member or a staff member has a death in the family. Let me take another question or two here, Carrie. Someone asks, is there any way that CUNY can provide PPEs for students?
I think if you've been watching the news, you'll be aware that PPE is in very short supply, and the people who need it most are the healthcare workers and first responders who are on the front line of battling this disease. We unfortunately are not in a position to be able to share the PPE, and honestly, if you're if you're not a healthcare worker and you're not a first responder or an essential worker, then you should be relying on personal hygiene and distancing to protect you, hand washing, and staying home. If you need to come to campus, there's going to be sanitizers. We are disinfecting all of the surfaces. We are enforcing a physical distance policy. And those protective equipment, such as gloves and respirators and masks, are really reserved for the people who need them most.
Thanks. The question came is, will financial aid be effective for this fall? Yes, it will. Questions include on our list, are there going to be classes in the fall? Yes, there will. Are there going to be classes in the summer? Yes, there will. If you are coming in, we have a question from someone who says they're an upcoming freshman. How are the creative writing classes at Rockland College? The creative writing classes are amazing at Rockland College. We have so many graduates of the college, specifically in the field of creative writing, who are superstars, MacArthur geniuses, etc. And that's because we have outstanding faculty in creative writing. I really want to encourage you to come to Rockland College and work on creative writing. And we're doing it through distance education right now. And the faculty are extraordinary. Let's see what else we've got. The shorter your questions are, the more likely that I will be able to read them. And
I'll take that about from someone I can't quite see. I noticed that you removed the Purell hand sanitizers, Linda Flame. Oh. No, you can please give me that location. I want to know where that is. But every building, we have shuttered many of the buildings, and as we've removed as many students and faculty and staff from campus to help us prevent the spread further. But in those buildings where we have staff coming to the campus every day, there is Purell hand sanitizer stations. I don't know Purell, but they're hand sanitizer stations, and they are in place, 100%.
So that's a good one. The other piece of this is that we ordered more hand sanitizer stations. And then we ordered the ones in particular that you didn't have to touch anything to get them. Like some you have to push on it. Some you just put your
hands free.
Right. So hands-free one, we have ordered many of those. They haven't come in a rapid, the chain of supply is really slowed down on all of those. Someone says they're not all filled. That's absolutely right. What we do have is the ability for you to report to us when they're not filled. And I really would appreciate it if you could, through the app, BC Fix It. If you could use that app and let us know so that we can go around and students aren't on campus right now. Folks aren't on campus right now. But when you come back to campus, when we open things up again, you will have the opportunity to let us know and help us, let us know when there are problems in the bathrooms. Let us know when there are, a hand sanitizer is out. Folks are saying they want to know more about graduation. let me go back to that. I talked about that at the top of the hour, but let's go back to that again, because I know that a lot of the questions were about graduation. We do not know what's going to happen with graduation. I cannot imagine that at the end of May, it's going to be safe from a public health perspective to assemble 18,000 students and faculty and loved ones in Barclays. So we are looking at alternatives. And we're looking at our alternatives. The chancellor and the central office is looking at alternatives across the entire CUNY system. And we're within a system, and we have to wait for their guidance. Whoever is saying this here is true. It may be delayed. It may be, just pushed to a different semester. We may have the same thing. It may be an online ceremony. It may be some combination of the two. We may pull certain classes together. We're not sure what we can do. I hear you. Someone says, don't make it online. Whatever we do, it needs to honor the extraordinary work of the students, right? It's not just, often graduation for many students is not just their victory individually. It is a victory of an entire family, a community of support. So we know that. We want to give you the kind of extraordinary experience that you deserve for graduation. We want to give you something that makes you proud and makes your family proud and honors the extraordinary hard work that you went through to get to where you are when you graduate. And we just doubt that it's going to happen in May. So we're going to have to figure out how to do a graduation that honors the great work, that allows your family and friends to celebrate, and makes you feel like this celebration validates all of the sleepless nights, all of the hard work. I hear a lot of concern about having it online. I hear what you're saying. We will await guidance from CUNY Central, and we'll let you know as soon as we know. I'm just looking at the comments here. Don't make it online. Don't make it next year. I hear you. We're going to do it as soon as it's safe, okay? And
I was going to jump in on a couple of comments. I saw something from Danny Vasquez, Danny VAZQZ. How will Brooklyn College work towards providing the services that came as a result of the pandemic for all semesters to come? If there is a silver lining in this, it is the tremendous amount of work that has come out of this. And we are, there is that potential and prediction that while we may see a slowdown in the summer months, that there could be an uptick and a wave in the fall. And so we're going to be more nimble and flexible and ready to put these plans back in place if and when that is the case. And it's going to serve us moving forward. For some people, they don't like the online, but a lot, my kids are doing great with online classes. They're able to manage it. They don't seem to be doing as much work, but it's, it's something that we got better at very quickly. I don't know how long it took, but something like within 1 week, we had 95% of our classes moved to remote learning. That's pretty incredible. So silver lining.
Yeah. So here's also what I want to say. Here's a couple things that we have ramped up as a result of the pandemic. We have a more robust food pantry. We have more devices to loan out to students, iPads, Chromebooks, laptops, and they are going to be with us. They're loans. We will get them back, and we will have a larger supply to give to students in need. All of the other services that we normally have, personal counseling, health care, and other counseling services will remain when we go back in person. So those are not new services as a result of the pandemic. They are simply moving those services to a remote location when we do it. Let's see. What about the music majors? Let me scroll that back down. Who don't have instruments? How are they going to be able to practice? So That is an issue that the music department is dealing with, and the dean of the School of Visual Media and Performing Arts. You should talk to those two people. They are working on a plan to try to ensure that people have access to the instruments they need their coursework. My professors are prescribing more work to do. And I'm trying to focus while having a 3-year-old at home. And he also has to do online learning. Yeah, I think for many people that's huge. Someone says they hate online classes, particularly for acting. I hear you. I think some classes are easier to do remote than others. There's no question about it. And for some people, their lives are complicated in a way that makes work at home particularly challenging, particularly when you don't have access to daycare or your kids in school, and you have responsibilities for care, for elders, for youngsters, for others. And that's a real challenge for us. And I think we should spend some time thinking about what we can do. I think it's hard because the social distancing mandates mean that we have to remain at home and can't support one another in the ways that we have heretofore. But it's a really good question, and for many people, even if they have all the devices in the world, working at home is a struggle. It's a big challenge. Okay, what else do we have? Let me look. Go, Gary.
I was going to jump in. Something from Los Couture. May I ask, would every room in BC be completely cleaned by the fall? Look, we have got a process in place. And we already put it in place as we started to close down those buildings. We cleaned and sealed. No one's going in. We actually put a sign on that says, you know, the last time it was serviced by our custodians, they were cleaning with a disinfectant. So classrooms, hallways, doors, elevators, as we have removed people from those buildings, those spaces have been cleaned. And I assure you that that will be the case until we open back up the campus.
Yeah, there's a question about getting the student activity refund. Since you're not on campus, we don't know the process by which they're going to refund that 25% that the Board of Trustees just passed last night. When we know, we will certainly tell you. I mean, one thing that I can say is, that the daily messaging that I've been doing has meant, it has given me an opportunity to think, what do the students need to hear? What do I know that they don't yet know? And how can I get that to them as directly as I can? So, you know, if you have questions or concerns, you can email me. You can email your faculty members. You can email the deans of the colleges, of the schools at the colleges. You can email the chairs of the departments, and we will try to get you can email student affairs, and we will try to get your concerns attended to. Yeah, a lot of people are saying that it's hard having kids at home and trying to do work. It's so true. It's so true. I think many people are experiencing that.
Michelle, yeah. I was just thinking that it's also a good time to acknowledge yesterday was National Doctors Day. And yeah. I just think it's important to say we have pre-health professionals program at Rockland College. So students may be volunteering with EMS services, with law enforcement. We have people who are working jobs to pay for their tuition. Yep. They're working as essential workers, and many of them are working double shifts. And I want to say thank you for everything you're doing, from environmental services to being lab techs to any health professionals out there, anybody who's supporting the work that workers who need to get to work, whether you're doing childcare or working at the bodega at the corner. I think the people who are doing the work, who are showing up every day, including our custodians, our peace officers, our public safety officers, they are near and dear to my heart. My God, they are so amazing, and they are so dedicated to the work that they do. I just want to acknowledge that, send my love and thanks out to them, and then just also let people know that we are taking care of our people, and
Yes.
they are well protected. They've been trained. We make sure that if someone is older or has a condition, that we're taking that into account. So please know that we're doing everything we can to make sure everyone is safe.
All right, y'all, this has been super helpful for us to hear from you. We will do this again. Your questions are valid. I will let you know as soon as I can about graduation, okay? Please try to find in your heart gratitude. I think Carrie lands on the right note to end, right? Someone mentioned Yvonne, who is a custodial worker at the college. We all know and love her. We want to protect her, and we're trying to take into account people's risk factors in terms of their rotation schedule. We love you all. We wish that we were on campus with you, I miss being on campus. I don't want to be working from home. I want to be on campus. I want you on campus. I want us all to be together again. But it will not happen in the short term. And the more we stay home, the safer it's going to be for the people at risk. That's what experts like Carrie tell me. That's what experts like Dr. Fauci tell us. I really really care for you all. I hope you stay safe. I hope you stay home. I can't wait to see you again. Oh, Carrie's going to put on some bunny ears or puppy dog ears. This is great, Sparkles. If I knew how to do that, I would do that too. Thank you.
Oh,
love
no.
Kisses and oh, whoa, that's terrifying. Whoa. Okay.
Bye, guys. I can't wait to see you on campus.
Okay. Bye.
So weird.
Very weird. I don't know how to publish this or save it. Is there something?
Does
anybody know?
I don't know.
Okay, well, it's one of those things. Hold on, my daughter, who's 12, might know. Avon, how do you publish it?
Publish it?
Save it? Publish it?
What are you talking
Okay, hold on. What if I press that? Share? I don't know. No, that seems like I'm sharing something. Cancel. Okay, that's beautiful. That's lovely. That's taking a picture. I don't know how to save it, Anita. So if you can, we're trying to end this. Oh, I wish I had some cool reflective glasses. Here's what I promise. By next one, we will put on, I'll have like bunny ears and glasses. It'll be fun. But for right now, I'm not sure how to end this. I'm just going to end this, guys. Love you. Thank you.